Hello and welcome. I'm Chesley McNeil, and this is The Take, where we go above and beyond the headlines and we look at the why and how stories are impacting you and your community. We invite the experts in to share their take on today's top stories, and we try to have just a little bit of fun as well. But today, we're going to start the show off with some breaking news. The escaped inmate that has been on the run for 3 days is now in custody. Timothy Shane was arrested this morning on Morris Drive in Covington, that's in Newton County. We now have a live look of the Rockdale jail, where he is currently behind bars. 11Alive Seth Haynock just arrived on the scene. Seth, what are you seeing out there? Tell us what you know.
Yeah, well, Chesley, what we know is that Rockdale County Sheriff say that Timothy Shane was captured here in this neighborhood in Covington after they say he was seen knocking on doors. We spoke to a neighbor leaving his home nearby. He says he had no idea any of this was happening, and he actually just woke up. But Rockdale County releasing this image right here on your screen in the last hour and a half, showing the moment Shane was apprehended with the help of a K-9 team and assistance of local agencies working together. He's seen here in the red hoodie and no shoes on, and this comes days after Shane first escaped from custody while being treated at Grady Hospital on Monday. He had been on the run ever since. We're also hearing that Shane was located at an abandoned home here in this neighborhood. We're waiting to get more information confirmed, but we know Rockdale County Sheriff say they will be holding a press conference at noon to share more into their investigation. Live here in Covington, I'm Seth Haynock. Chesley, back to you.
Seth, thanks so much. Really appreciate that. We're going to continue to follow the latest developments on this breaking news story right here on 11Live Plus. As you know, we're also streaming live news, weather, and real-time traffic. All right, for 43 years, the Metro Atlanta comes together for one purpose, and that's to fill the shelves and fill hearts. The 11Live Holiday Can-a-thon returns Friday to help the Salvation Army of Atlanta fill 13 food pantries for the entire year. It's a drive-through of giving that's helping to feed thousands of families over the years. 43 years, in fact, we've been doing this now. Here to help us get ready for the big day, Major Thomas McMichael's my TV buddy, I call him, especially this time of year. Welcome to the show.
Oh, thank you so much, Chesley. I think it's great to be your TV buddy.
Yeah, we appear together in commercials and everything. You know, it's one of my favorite events. Every first Friday of December, we do the 11Live Holiday Can-a-thon. Talk to me about the need here in Metro Atlanta now.
You know, throughout this whole year, we've had a greater drain on our food supplies and in our food pantries. And so this year, incredibly important that we can able to restock those 13 food pantries and to prepare ourselves for the holiday season where people's needs just go up because they're spending money on toys and everything else that they have for the Christmas season.
You get to hear the testimonies firsthand. You're right there, hands-on with the people. What have they been saying about this year?
They've been saying that they're a little more desperate than usual because of, you know, every time a price hike comes in, it may not be, you know, dramatic for you and me, but for people who are really on the edge, it can be devastating to their family. And our food pantries not only help the people who are homeless, but they help bridge between paychecks for some families that can't make it stretch all the way. And so it's a vital work for this community. And it's always great when we have a Can-a-thon because then we see the community come together and aid each other.
Yeah, a lot of folks want to get out there and help out. Some may be watching us and they're saying for the first time, hey, you know, I always wanted to get involved with that. Tell us what type of canned goods or type of foods and donations that we need.
Anything that's shelf stable. Mm-hmm. That can be cans, like boxes of macaroni and cheese or bags of noodles, anything that's shelf stable that can sit on a good shelf that we can then give out through our food pantry. You know, and don't think anything's too small. You know, people bring just a small little bag of cans and you think, oh, that's not much. Oh, it makes such a difference.
Yeah, absolutely. And talk to us about the process. We'll have those big bins that you're seeing on the screen right now out there. We'll try to fill those bins up. What happens after you gather all that food?
That food gets sent to our warehouse, we sort it out, and then we start distributing it out to our food pantries. And the more cans, the more food we can collect on that day, the longer we can sustain our food pantries as we go along through the year. Because we're giving out food every day, all year. And I mean, we're talking about tens of thousands of people and families that depend on what is going to happen on Friday.
Yeah.
For their holidays and throughout the year.
So it's not just food. You take monetary donations too, right?
That's right. And that money can help supplement because we're getting shelf stable material or food during this. You know, we have some meats like tuna and things like that, but there are things that we need to buy throughout the year. You know, I mean, because milk, that's not something that we would collect at the Can-a-thon or meats that are in the refrigerator or anything like that. So we use that money to purchase food.
Talk to me about your community partners. I know you don't do it by yourself, and you don't want to. You're welcoming volunteers all the time.
Oh, listen, it is such a wonderful event. We have great partnership with 11Alive, which we're so grateful for. We have a great partnership with Publix, who really is a foundation of this process. And then if you go out and just take a bag of cans to one of the locations, you will see a whole bunch of volunteers out there that are not paid Salvation Army folks that are just out there helping with the Can-a-thon. And if you want to help with the Can-a-thon or anything else with Salvation Army, we welcome that too.
The Can-a-thon has been around for 43 years. I've only seen about 17 of those. How many have you been a part of?
This is only my fifth, because I've been in Atlanta. It's my fifth year, but I have staff that's been here practically all of them.
Wow. And talk to me about the emotional toll of the event. I know it gets your heart pumping.
Oh, it does. You know, and I have what I say is the best job in the world. I get to see the community give to others, and I get to talk to them, and I get to interact with them. But then I also get to talk and interact and work with the people who are in need. So I get to watch that can all the way from somebody in the community's hands into the box, into the food pantry, into a family's home. Yeah. And it's the best job in the world.
We'll be at several locations around the metro area. Will you be going to all of those, or where will you be?
Well, I'm going to start at Marietta with you. And we'll be doing the morning, and then, I work my way around. Oh,
so you get a chance to go all the way around. Okay, all right. So, yes. Marietta, if you're watching, we want to collect the most cans. And so no shade to the other locations at all, but because I'll be there, along with the major, we want the most cans up there in Marietta. Always a friendly competition, and we always brag about who has the most cans or who collected the most cans. Yes. Just a fun start to the holiday season. Giving is always better than receiving, of course, and we appreciate you and all that you do for our community, Major. We really appreciate you coming on.
Thank you so much.
Absolutely.
Take care.
All right, we'll see you Friday. Maybe in the rain, right?
Yeah.
You can find all the details at 11alive.com/Can-a-thon and be a part of the holiday tradition that keeps on giving. 43 years in the making, folks, and we'll keep doing it, all right, so that need gets knocked out. All right, we're going to have a quick check of your forecast when we come back. Plus, we'll have much more stories for you as well. Stick around. Don't go anywhere. We're back right after this. Hello, everyone. We are looking at a few clouds overhead right now. Those clouds are not yielding any rainfall, any precipitation at all. We're not worried about that. Nah. Those clouds are breaking up, and we'll get the sunshine in here. Today is going to be the day that if you have anything to do outside, like string up those Christmas lights or maybe rakes up some of those leaves, this is the day that you want to do that. We will have the sunshine around, but you will need a jacket or a coat, as temperatures will be on the cool side. We started out with temperatures down into the 30s. This is where we are right now. Low 30s out there as well. Places like Blairsville and over toward Carrollton, starting off below the freezing mark. We even started out at the freezing mark here in Atlanta, but that temperature is starting to rise as the sun continues to rise in the sky. We're not the only ones throughout the southeast. Those clouds have been pesky, to say the least. At least there's no precipitation around, although that will start to grow again. We'll see the clouds get out of the way this morning. And then once we get to the afternoon, those clouds will start to build back in. Well, actually, later on tonight, the clouds will start to build back into our forecast area. And we'll have a slight chance for a shower starting tomorrow. And that's going to carry us right on through the upcoming weekend. High pressure is building in. We got a northerly flow over us. Those winds should remain light for the most part today. This front is breaking up, so that will get out of the way. That high pressure is up there to the north. And so that's what's bringing in that northerly flow, keeping us on the cool side. In fact, what we call a zonal flow. Right? Not much change or fluctuation in our conditions or the temperatures as well. And so that's the way it has been, and that's the way it's going to be. You look at the cold air sitting just to the north of us, mild air sitting just to the south, and we're kind of sandwiched in between here. And so you're going to notice not much fluctuation here. Of course, daylight opposed to overnight changes just a little bit. So you'll see temperatures go from the 30s all the way to the 50s, and that's the way we have been. So we'll have these chilly mornings, and then once we get to the afternoon, temperatures temperatures will rise closer to the 50-degree mark, which is still below our average for this time of year. And so we'll continue to see that back and forth for the next couple of days. Now, there will be some precipitation that moves in, especially for Friday. That will have play at least a role in the temperature just a little bit. And then once we get the sunshine back, as we head into the weekend, we'll start to see that go up a little bit, coming back down as colder air will start to make its way back toward us as we head into Monday. Got some colder air moving in, so that'll be a cold start to the work week for us. And then we'll see those temperatures modify as we get back to the middle of the work week. You can see by Wednesday, some of those milder temperatures will come back our way as we get a change in the pattern. Tomorrow, it's a 20% chance for an isolated shower or two. A lot of us just won't see it. And then an 80% chance on Friday. All of us will see it. Some moderate pockets will be around. Back down to a 20% chance as we head into Saturday and Sunday. Again, a few of us may see an isolated shower or two. For the most part, over the weekend, we'll just have partly sunny skies, and those temperatures will modify a bit. We'll see those temperatures getting back into the 50s by the weekend, and then that warmer air will come by the middle of the work week next week. So there you have it, folks. Grab your rain gear. You're going to need that, especially as we head toward the end of the week. We're back right after this. All right, let's welcome back Sarah Farmer, Director of Testing and Evaluation of Center for Advanced Communications Policy at Georgia Tech. Sarah, can you hear me?
I can hear you.
And I can hear you. All right, at its highest level, what talk to me about this technology that we're talking about that could help in the childbirth care?
Yeah, so we underwent this research because, as you know, pregnancy complications and maternal mortality is an issue in Georgia, particularly in rural areas, as well as across the nation. And we believe that there's a prime opportunity for technologies to improve patient outcomes and increase the safety of mother and baby. But past research has shown us that there are barriers to adoption of the use of these technologies, both for patients and healthcare providers. So our research has shown us that these technologies and the adoption and use of them often hinges on the patient healthcare provider relationship. So as we did this research, we really wanted to better understand the relationship and the attitudes toward technologies for both of these groups.
So talk to me about, I got you. Talk to me about why now and what's changed in the technology to make these better outcomes happen.
Exactly. Wearable health technologies, and just for the viewers, in case you aren't familiar, the most basic example is kind of an Apple Watch or a Fitbit. So it's any device that you can wear on your body that's collecting and monitoring health data. So Fitbit, Apple Watches are sort of on the consumer side, but then there's also medical grade devices that can be used as well. And we really, the research community is creating new sensors and new capabilities all of the time. But if there's this disconnect between women actually wanting to wear these during labor and delivery and healthcare providers, buying into the adoption of these technologies, that's kind of where the barrier is. And that's what we want to understand. So that as these new wearables and technologies are created, that hopefully women and healthcare providers are actually comfortable using them and trust the data that's coming out of them.
Where do you see the real world usability breaking down most often in these early prototypes?
Oh, yeah. So there's a lot of different things going on. So often there's mistrust of the technology. Mm-hmm. There's a lack of adequate training and education. So both the healthcare provider side, they need to understand how to use these technologies. They need to have support if they're troubleshooting. And the same for the women. They really need to understand the utility of these devices and, understand why this data is going to help keep them safe and help keep their babies safe. But beyond that, there's often cost. There's concerns about privacy and security. So it really is the whole system that we have to look at here. So
you guys have done a focus group. You've talked to these mothers. What have they been saying about this, especially about privacy concerns? What else have they been talking about?
Yeah, so we surveyed 4,500 women and healthcare providers across the country, and then we did focus groups with 110 of those individuals, and they had so much to tell us. So we found a couple of interesting things. Women tended to want, when we asked them what measurements they would want to get out of these wearables, they tended to want the more familiar measures that we're already kind of seeing in wired technologies. So things like blood pressure, maternal and fetal heart rate, fetal movement, things like that. Whereas the healthcare providers are wanting that cutting edge data. They want new, data coming in. They want to kind of go beyond what's the standard of care. And so that in itself is kind of a mismatch, a gap, because the women have to buy into these as well. And so I think that is part of the interaction of the relationship between healthcare providers and women who are pregnant, and understanding that relationship and how healthcare providers can provide the information that women need, and and, help them build trust and things like that.
So I have about 15 seconds left. If I got a mother watching right now, what do you want to tell her about where the technology is headed?
Where the technology is headed, I think that the opportunity to help women is really there. So understanding, again, where the barriers are, help them understand that there's new technologies and devices, and sometimes that can be a little bit scary, but these are being designed to help them, and we hope that we're able to improve patient outcomes.
Absolutely. Sarah Farmer, thanks so much for joining us. Really appreciate it. All right, take care. All right, take a live look right now on the connector north near University. Yeah, you can see just, some busy traffic right there, Doug. I mean, Doug causes these accidents personally just so he can have a job.
That's it.
Keep
like Donkey Kong with banana peels, all right?
No, he's our Gridlock guy. He monitors this stuff. He knows all about it. New numbers show traffic volume jumping about 18% in the year's final months. And with the holiday parties ramping up, safety officials are worried about the growth concern. Right? Doug Turnbull's here to talk us a little bit more about it. You've been digging into these numbers. What have you been finding out?
Yeah, for sure. Well, look, it is no secret that there's a lot of revelry that goes on this time of year. There's also a lot of stress. We got last minute deadlines. You're trying to get to somebody's house on time for a party. And so I reached out to the Governor's Office of Highway Safety with just some holiday traffic tips, or is there something more that the state is looking for when they're out enforcing on the roadways? And basically, the executive director, Alan Poole, who I've known for years, he told me 3 or 4 different things that they're looking for. All right. He told me that they're looking for, of course, impaired driving, and throw in distracted driving with that. Anything that takes your eyes off the road or makes your senses less sharp. And there's a lot of that going on with people at these parties, and a lot of drinking that goes on. Secondly is speeds. We did this story earlier this morning here on 11Alive about how speeding, the more you speed, the more likely you are to lose control and the less reaction time you have. And then with other drivers distracted around you when you're speeding, if you're deciding, hey, I'm going 90 miles an hour and 75, well, if you make a mistake and other people around you are distracted, it's a recipe for disaster. The third thing they're looking for is seatbelt use. All right. And it's really a surprising number. It's been decades that we've had seatbelt laws in cars. Of course, I know people don't just follow the law. OK, but seatbelt use is not 100%. In fact, it's well below that. You are way more likely, Poole says, to survive a crash if you wear your seatbelt. It's just simple math. In fact, he said simply to me, the safest thing for you on the roads is remaining inside that steel cage. Your seatbelt keeps you in place.
Yeah, got to use it. You've been studying and monitoring traffic for a long time. This time of year, do you see a higher volume of accidents or anything like that, distracted driving, in any particular place more than the other?
As far as crashes, I would say the biggest place to see crashes, you look at some of that just marquee traffic we have here around town, really the places where fast meets slow. So think about what we just experienced on Sunday, right? Coming back for the holiday, all right? I was coming back from Jacksonville at 75. You're wide open in South Georgia. Thankfully, my wife was driving. She's the cruise control. We were just 65, 70 miles an hour, real safe speed there. But then that traffic started to slow down north of Macon. And it's when fast meets slow that you see those points. I can't point to a spot around town, Chesley, although interchanges are where fast meets slow, like Spaghetti Junction, 285 connect with 85 or vice versa. But any of those places where fast meets slow, it's a friction point. Friction equals kaboom.
Oh, yeah, absolutely. Over the years, especially as technology continues to grow, I find myself even being distracted. It's almost like you got a job, you got these things going on, and driving has become this thing of a must need to do, but I'm also thinking about all these other things. How much of it is just trying to pack your patience and being aware and paying attention?
Look, if you were a driver, you have one responsibility: 2 hands on the wheel, eyes forward. With all of the technology in your car, Chesley, you just mentioned, it's easy to both take your mind off of it, but also let the technology do the navigating and the driving for you. I mean, we have autonomous vehicles now. We have, of course, for years have had GPS apps. Well, even those aids, even the blind spot deals, things that make the car safer, if they take that sharpness out of, I need to look over and check my blind spot, that means you're a little bit less committed to your ride. And then, of course, there's all the stuff your phone can do, even when it does it legally through the car's dashboard.
Wow.
A lot of places your mind could go. When we're at a 70 mile an hour, 3,000 pound bullet, it's best to look ahead.
Yeah, you just start getting dependent on the beeps. Beep, 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 beep. Instead of looking back. I still tend to do that, but I do find myself being distracted. Anything else you want us to know, especially for this holiday season, going into this heavy traffic time?
Yeah, for sure. I mean, look, The legal limit is 0.08 of blood alcohol content, but if you're really planning on having a drink, and certainly more than one, you need to stay from behind the wheel. There are way too many excuses and ways to get home without forcing yourself to white knuckle a drive. Not only is it illegal, you're just much more likely to crash. A large percentage of crashes involve alcohol.
All right. Doug Turnbull, Gridlock Guy, appreciate your insight, man.
Always good to see you, Chesley.
Always keeping us safe, too. Love this guy.
Trying to.
All right, folks, don't go anywhere. There's more you can do with the digital ID. We're going to discuss it and have that conversation when we return. Welcome back to the show. Now, an important reminder as we head deeper into respiratory season. Adults 65 years or older remain at the highest risk for severe illness from COVID-19, flu, and RSV. Health officials say even mild symptoms can turn serious quickly. The CDC says adults 65 years of age or older account for more than half of all respiratory-related hospitalizations each winter, far more than any other age group. This age group also represents nearly 70% of COVID-19 deaths, even as overall mortality has dropped in recent years. The update COVID, flu, and RSV vaccines can cut the risk of severe illness for older adults by at least 50%, depending on the virus and timing. Here to explain a little bit more about it is Dr. Juanita Mora. Welcome to the show.
Thank you for having me to discuss such an important topic.
Absolutely. Let's get right into this thing. What is it about the aging body and the immune system that makes respiratory infections more dangerous after 65?
Well, what we know, Chesley, is that our immune system weakens with age. So 65 years and older are going to have a weakened immune system. 2, people greater than 65 years of age and older are also going to be higher risk for chronic medical conditions that make it more likely to have COVID-19 complications such as diabetes, high blood pressure, cardiovascular disease, asthma or COPD, and emphysema. And the third thing is when we look at the data from October of 2024 to September of 2025, we have had 44,000 deaths in our country from COVID, and 2/3 have been in people greater than 65 years of age. This is why it's so important that we drive home the message that people get vaccinated.
I think a lot of people out there are thinking, COVID is milder now. You're seeing less people wear masks. What about for our older patients? Is this actually true? Is it milder for them as well, or no?
Well, no, because what we know as well, too, in people greater than 65 years of age, repeated infections put them at higher risk for long COVID symptoms such as new onset asthma or COPD, and even complications such as strokes and development of Alzheimer's, heart attacks, arrhythmia. So this is why it's so important that we continue to get vaccinated and protected.
What about those that say, hey, I just have a cold, right? And they don't, and it turns into something serious?
Well, we want to make sure, one, that people continue to be tested, especially before we head into the holiday gatherings, right? Because we don't want to propagate this virus among our most vulnerable, the newborn babies in our family, the people greater than 65 years of age, anyone who might be on chemo, etc. So we want to make sure that people continue to get tested. COVID-19 test kits are still available at pharmacies. They're inexpensive, and they match well with the current actual virus that's going on right now for COVID-19.
Walk us through the red flag symptoms. You're talking about breathing changes, maybe confusion. You mentioned a few of those. Talk to us about those.
Sure. With COVID-19, what we're seeing now with the current strain that's circulating in our country is a lot of sore throat, high fevers. Begins like a regular cold. So it begins with a runny nose, nasal congestion, postnasal drip. But then it turns into some of the actual symptoms that we know well, that hard cough that people get that won't go away, and the wheezing that can occur. And then also people are getting the loss of taste and the loss of smell that continues to be part of COVID-19. Mm-hmm. Now, worrisome symptoms that I always teach patients, making sure that they go to an ER for any worsening shortness of breath or wheezing, a cough that won't stop, or any neurological changes, fatigue, or signs of dehydration. Because sick people sometimes can't drink or eat, so they might be sleeping all day, lots of fatigue, and are greater than 65 years of age, and our younger ones, we need to monitor that as well, too.
Yeah. All right. Lastly, for those that are watching who may be a little bit skeptical, right, what one piece of data or advice or anything that you can give them to help them, push them over the top to go ahead and get checked out, or get that cough checked out?
Sure. So first thing is go to a trustworthy website where you can get more information on COVID-19 vaccines. So that's going to be at the Champions for Vaccine Education, Equity and Progress, CVEEP.org, or you can go to your local Department of Public Health, talk to your trusted messenger, your local doctor, your local pharmacist. Remember, COVID-19 vaccines are well covered under insurance, even Medicaid and Medicare private insurance. So 'tis the time to get vaccinated and protected. And if you are skeptical, have the conversation with your doctor like my patients do with me. And I love, so that way I can share good information and clinical research and make it so you can make a decision based on science.
All right, Dr. Moore, thanks so much for your insight today. Really appreciate it.
You're welcome. Have a beautiful day.
All right, take care. All right, for years, families told 11Alive News investigates the system meant to protect children was tearing theirs apart. Our Help That Harms leads series to a new Georgia law giving parents the right to a second medical opinion when doctors suspect abuse. But senior investigative reporter Rebecca Lindstrom questions whether these changes is protecting families as promised.
A playground filled with laughter.
He hugs me a lot more, he gives me kisses.
A far different scene than 2 years ago when these same families sat down to talk with 11Alive News Investigates about why a child abuse pediatrician believed they had beaten, starved, or somehow neglected their babies.
We kept asking and pushing for more follow-up x-rays, and they wouldn't do it anymore.
But on this sunny day, all of those families were reunited. The charges dropped.
We, the jury, find Brady Lee Timms not guilty.
Families found not guilty, or their time in prison over. For Terlin and Tyler, the sentence was 18 months. They both maintained their innocence.
Many had been advocating for themselves for months. Please listen to what I have to say. I didn't hurt my baby.
After 11Alive's Help That Harms series exposed how one doctor's opinion could tear families apart, the legislature passed a new law to give families the right to a second medical opinion. But now they say what we need is accountability. The commissioner over the Department of Family and Children's Services sent out this policy memo telling her staff to make sure they were treating the doctor's diagnosis as an opinion, not the only opinion.
Hopefully staff will see that if I personally am willing to put my name on the line, my reputation, my credibility in the courtroom, and advocate for that they can too. They can safely do it.
To help caseworkers, DFACS asked doctors like those at Children's to fill out a form assuring they had reviewed all of the child's previous medical records to rule out other causes before diagnosing the injuries as abuse. But in court testimony, 11Alive News Investigates learned doctors aren't completing the form.
The language in the medical attestation that's been provided by DFACS is under review by our legal department, and they've advised us to not sign it.
Even in this recent email exchange obtained through open records, one doctor at Children's says he sees the form as overtly broadcasting distrust and wants caseworkers to stop asking him to sign it.
The law doesn't even really specify who has the responsibility for telling a parent that they have the right to a second medical opinion. I spoke with one mom accused in August after the law went into effect. She says no one told her. Not DFACS, not doctors, not social workers, not even the public defender assigned to her case seemed aware.
As new cases emerge, advocates say the new law will mean nothing without more training and enforcement.
When a mandated reporter, whether it's a social worker or a doctor or a nurse or a law enforcement professional, when they fail to properly investigate this, I don't believe they're entitled to the immunity that they currently have.
Ryan Ralston with the nonprofit You Are the Power says as new cases emerge, the new law will mean nothing without more training and enforcement.
Nobody deserves this. I just want to live in the moment right now and get my life back on track. Give me a kiss.
Rebecca Lindstrom, 11Alive News Investigates.
Thanks a lot, Rebecca. Really appreciate that. Don't go anywhere, folks. CNN's Maribel Aber joins us next with How Your Money Matters. We're back right after this. Welcome back to the show. A wave of new tariff costs are about to hit, and companies warn it could mean in the U.S., fewer jobs next year. CNN's Maribel Aber joins us now from the NASDAQ market site in New York. Hello, Maribel.
Hey, Chesley.
Sounds like 2026 could bring some layoffs and not expansion.
Well, let's talk about the Trump administration's tariff agenda aimed at reshoring U.S. manufacturing jobs could add pressure to companies already cautious on hiring. Analysts note the labor market is already on shaky ground in a no hire, no fire environment. The concern is that higher production costs may push companies to delay hiring and slow their payroll growth. A report from the Federal Reserve last week showed a slight 7-week decline in employment as manufacturers cited tariffs and tariff uncertainty remained a headwind. The Organization for Economic Cooperation and Development reported this week that the full effects of those duties haven't yet been felt by the U.S. economy and will likely weigh on future trade volume. So we'll be watching for that one, Chesley.
All right, we will be watching closely. All right, looks like folks looking for a new deal on a new apartment. Maybe the market's ready for them.
Maybe, just not here in NYC. Listen, apartment rents are falling and vacancies are up. According to Apartment List, the national median rent for apartments fell 1% in November from October and now stands at $1,367, capping a 4-month decline. Now, the national multifamily vacancy rate was 7.2% in November, a record high. The historic surge in multifamily construction over the past few years is now pulling back, but new units are still coming online at a time of much weaker demand. Analysts say more young people are living with family instead of renting as a result of high prices and a tougher job market. Some cities with the sharpest declines in rents include Las Vegas, Boston, and Austin, Texas. Chesley.
All right. So I'm not a cranberry sauce guy, but if I pop open a can of cranberry sauce, I expect cranberry sauce to be in the can, but that's not the case for some, huh?
Yeah, it's not, we're not trying to solve a puzzle. Ocean Spray is investigating a series of complaints over its cranberry sauce or lack thereof. So customers, they're reporting opening cans of jellied cranberry sauce only to find they're instead filled with water. There's videos circulating online showing customers opening the water-filled cans have gone viral, one notching at least 10 million views. More disappointed consumers lodged their complaints on the company's website. Ocean Spray says it's reaching out to customers to learn more and make it right. Chesley.
So just water, not cranberry juice.
Just water.
All right. IHOP getting into the spirit by giving parents some help with a few bucks for their kids this year, huh?
Hey, IHOP bringing back its popular Kids Eat Free deal, offering free kids menu items for children under 12. The deal is valid with purchase of a full-size adult entree. It's available every day between 2 p.m. and 10 p.m. IHOP's December deal comes months after the restaurant launched a value menu starting at $6. The pancake chain says great food should be accessible to everyone every day. The kids menu includes junior waffles, pancakes, French toast sticks, as well as cheeseburgers, chicken tenders, and a breakfast quesadilla. The company also said kids will get a new activity sheet featuring pancake cartoon characters like Pam and Perry, a word search, joke, and other activities. The free meals are available now through December 21st. Chesley, the kids and parents both win here. I mean, it's great for families needing that break during the holiday shopping for sure.
Absolutely. Fill their bellies up. They make them go to sleep later,
There you go.
Maribel, thanks so much. Really appreciate you.
You got it.
All right, take care. All right, folks, don't go anywhere. Cobb County is looking into to take a look at their transportation system. They're going to bring it to the next level. We're going to have that conversation right after the break. Don't go anywhere. Welcome back to the show. Cobb County is taking a major step toward what it believes to be the future of transportation. A new $6.6 million federal grant will help launch autonomous shuttle network in the heart of the Cumberland District, connecting everything from Truist Park to the Convention Center. Kim Menifee, the executive director of the Cumberland Community Improvement District, is here to break down what this means for mobility, access, and our everyday commuters. Welcome to the show.
Thank you. Good morning, Chesley. Great to be here.
Glad you're here. All right, so what does this project signal about the future of transportation in Cobb County?
We are very excited to be partnering with Cobb County to bring autonomous mobility to Cumberland. Cumberland is one of the busiest job communities in the metro Atlanta area. We're also a major destination for enjoyment, and we really are super excited to be able to bring this project forward for those who live, work, and visit the district. The shuttle network will have 8 American-made ADA accessible shuttles that will help connect people to jobs as well as all the major destinations in Cumberland.
So we're looking at one right now on the screen, and this looks like it's almost like a rail car. So will it not be on the road? Will it have its own kind of pathway that connects everything together?
Actually, the technology will be the most advanced available. It will run in lane on the road up to 35 miles per hour, and the shuttles will carry 12 to 15 passengers, creating reliable, efficient public transit for our community.
Wow. How critical was the federal grant that was given to get these autonomous shuttles networks off the ground?
The funding was absolutely essential. We are absolutely grateful to the Federal Transit Administration for their confidence in this project to be able to bring this public transit, this next generation transit to our community. Without the funding, we would not have been able to partner with Cobb County. This project will actually be a part of Cobb Link, the public transit that runs here in Cobb County. They will be the operators, and we will work with them to launch this program in 2027.
Yeah. What does this mean for residents who may not currently have easy access to reliable transit?
Well, what's really exciting is that this, the autonomous mobility is part of a larger project called the Cumberland Sweep. So we're working to make walking, biking, and autonomous mobility more accessible, helping people connect to current transit and future transit, as well as all of the major destinations here in Cumberland, as you mentioned, from Truist Park and the Battery to the Cobb Convention Center to the Cobb Performing Arts Center to our retail hubs, as well as the Chattahoochee River National Recreation Area. So it really provides a wonderful opportunity to connect to jobs and recreation in the community.
So those autonomous vehicles will stay on that particular path, right? That will be the designated route for those particular cars.
Yes, Cobb County will design the route. We'll be working with them. That will create the greatest and most reliable, efficient connections within Cumberland. We'll be designing the route. We'll be working with Beep. They are a leader in autonomous mobility to determine the the right shuttle to be able to bring and to activate as part of this network. So we're excited about working in partnership with Cobb and Beep to be able to bring autonomous mobility to our community. We know it will be a real winner, helping people connect in a much more efficient and reliable way using next generation technology.
Yeah, it has a target date of 2027, right? What still needs to happen to make sure we hit that target date?
It does. So we'll begin the planning now, working closely with our leaders at Cobb County, which we are very grateful for their partnership, to be able to work towards the planning effort so that we can put these shuttles on the ground, working with Beep to determine, as I said, the right shuttle to be able to bring forward. But we know that this autonomous mobility is going to be a real game changer in Cumberland, helping really people connect for that first and last mile connectivity that is sometimes a challenge for people. So we're very excited about what this means in Cumberland.
Who would you say is going to benefit the most from this new technology and transportation?
Everyone who works and lives and visits the district. We are a major job center. We have 88,000 jobs, 3,800 employers that are here within the Cumberland district. We have over 30,000 residents and millions of visitors who visit Cumberland every year. So we know that this shuttle system, everyone will benefit. And we hope that this grant will allow us to launch the program in 2027 and that we'll continue to build on it so we can bring public transit forward using this most advanced technology for decades to come.
Lastly, Kim, do you see this as a broader way to connect all of Metro Atlanta? Could that be possible with this?
Absolutely. The technology is here. So working through all the regulatory process as we are seeing this technology advance and become more available in the United States, this is a great way to bring public transit forward. It's much more affordable. And again, it's reliable and efficient. And it's a way for people to move around very quickly utilizing current transit. And then again, we want to see more transit in our city. So we believe this is a great first step, and Cumberland is the perfect place to launch an autonomous mobility network.
All right, exciting times. Can't wait to see more. Kim Menifee, thanks so much for joining us. Really appreciate it.
Absolutely. Thank you so much.
All right, take care. All right, another look at your forecast, plus my final take when we come back. All right, we are looking at clouds overhead right now, just a few, and they're getting out of the way. That's the trend for us. We'll get rid of those clouds. We are not looking at any precipitation coming out of those clouds at all. A little bit of a stretch of mostly sunny skies will hit us right around the 3 o'clock hour. And then you see back off to the west, more of those thinner clouds that will push in. Won't rob us too much of the sun. And so we'll stay clear at least right on through the overnight going into Thursday. Thursday brings more changes, right? We'll see some sunshine very early on, and then the clouds will overtake the area, and then a little small chance, a little small threat for some rain. A lot of us just won't see it. It's a 20% chance, folks. If you happen to get it, consider your lawn or the soil around your home pretty fortunate, because we are still dry. And then that heavy rain begins to push back in. We'll see it through the overnight Thursday going into Friday. Friday morning when you wake up, expecting for some showers to be around. You notice the moderate pockets around as well. Now that's our Can-a-thon day, folks. Don't let it stop you from bringing your donations to our various locations around the forecast area. All right, we'd love to see you. It will be a cold rain for us, though, especially in the morning. Temperatures will be down around 40 degrees, and we'll get up to 47 for an afternoon high. You got weekend plans? Well, we're looking at Saturday and Sunday, only a 20% chance for an isolated shower or two. 52 degrees will be your temperature on Saturday. Sunday, we're looking at 54 degrees for the high. I think colder air will start to move back into our area as we start the work week next week. We'll be looking at 40 to start off the day on Monday, and then 50 for an afternoon high. That temperature could be a little bit lower, so we'll adjust that as we go along, as we get a little bit closer, and then we'll start to see that temperature modify a bit. For those of you who like above average temperatures this time of year, got to wait till about Wednesday of next week when that will take place. Until then, grab your umbrella and come on out and join us for our 11Alive Holiday Can-a-thon. All right, every now and then you get an opportunity to work with some great people and do some very special things, and this show right here, The Take, was one of them. You know the old saying, all good things must come to an end. Well, The Take has reached that point. It is the ending point. Yep, the end of the show will take place later on this week. By Friday, that'll be our last official show to make room for other exciting programming right here on 11Alive Plus. Now listen, I'm not going anywhere. I will be here to bring you your daily accurate forecast, of course. Trying our best to be the most accurate. But I'd like to thank some people, some wonderful producers that we've had on the show. Jesse and Vivian doing a great job. Directors, Maria, and all the other directors who have worked on the show to make it great. They are the real stars behind the scenes, making everything come together. So I'd like to thank them. I'd also like to thank you for tuning in each and every day, encouraging me to be my best. This show has stretched me, folks, a little bit, and I'm grateful for it. Bigger things certainly yet to come. Keep it locked right here for the very latest up-to-date information right here on 11Alive Plus. It is our goal to bring you the news and the weather that impacts you and your community. Have a great day. We'll see you soon.